welcome. You're watching the Health Talk session by Yashoda Hospitals. Do you have a bulge in your abdomen? If yes, then you are not alone. There are about 2 million people in India getting diagnosed with hernia every year. The term hernia may be spoken about often, but many people are not sure what exactly a hernia is. So let's discuss about hernia and its treatment option in our today's episode. I'm Dr. Lakshmi, and joining us today, we have with us Dr. Vijay Kumar Bada, consultant gastroenterologist surgeon from Yashoda Hospitals, High-Tech City. Welcome, doctor.
Hi, I'm Dr. Vijay Kumar Bada, Senior Consultant, Surgical Gastroenterology, Minimal Access Surgery and Robotic Sciences at Yashoda Hospitals, High-Tech City, Hyderabad.
So, doctor, to begin with, what exactly do we mean by hernia?
So, hernia in common terms is just an abnormal protrusion of some of the important visceral organs to the exterior. Like all the important visceral organs are to be within the structures which are given by the nature. So when one of these organs or few of these structures start protruding outside, that is what we call it as a hernia.
So according to a recent survey, about 2 million Indian people get diagnosed with hernia every year. So what could be the potential causes for this, doctor, and what are the risk factors as well?
So there are many causes for hernia, and the causes differ between men and women and also at different age groups. So one of the most common causes of hernia, if we look at, will be say from congenital. Some of them can develop a hernia from birth. They are called as congenital hernias. And the other hernias are the acquired hernias. So the acquired hernias could be most commonly because of obesity, overweight. Overweight definitely is a huge cause for hernia. Any factors which increase the intra-abdominal pressure, like someone who's having a chronic cough, chronic constipation, or someone who has got a fluid in the abdomen or some tumors in the abdomen, they all can cause hernias. Apart from these causes, if in men, a weak abdominal wall due to age, or someone who is a very strenuous worker, heavy weightlifters, athletes, so they all can develop hernias in the inguinal region. That's called as inguinal hernia. Similarly, in women, pregnancy itself can cause umbilical hernia, or anyone who has got any previous surgeries, they can develop hernia at that previous surgery site. So these are called as the incisional hernias. So to be broadly to say what causes hernia could be one of these factors which increases the intra-abdominal pressure. It could be obesity is a very important cause nowadays, any previous surgery, and congenital.
So you've mentioned that there are different types of hernias for men as well as women. So doctor, what are the symptoms that one should look out for, and how would one know that they could be suffering with hernia?
Yeah, symptoms could be very varied. It could be, we sometimes have hernias which are asymptomatic. That means patients do not have any symptoms because of hernia. A simple way of could be that they find a bulge, a protrusion from the abdomen or some of the parts of the body which they haven't noticed that previously. Say suddenly the umbilicus becoming more prominent, bulge in the umbilicus, so someone might say that your umbilicus is looking a little more full. That could be a simple symptom. Some of them notice that in this area of the previous surgery, they find that there is little more bulge in that one. That could be another symptom we can take. But apart from this, some of them actually develop symptoms like pain at the site of the hernia. They could develop symptoms related to acidity, and they may attribute that to acidity, and they keep getting treated for acidity. But actually it could be a hernia which is causing that acidity. They could develop symptoms like a swelling which is not disappearing. Initially they would have a swelling which is sort of going inside, and they feel that there could be something abnormal. But sometimes the swelling stays there. That is called an irreducible hernia. Or they could present with a complication of a hernia, like an intestinal obstruction. They come with severe pain, abdominal distension, vomitings, constipation. So there could be varied presentations of hernia. But the most common one would be an abnormal swelling which they notice in some part of their abdomen or the groin, and some develop symptoms like similar to acidity, and some have the symptoms of pain. So these are broadly the important symptoms of hernia.
So doctor, is hernia a serious condition? Does it require surgery always? what are the treatment options available for this condition?
So one thing we have to remember is hernia is abnormal. It is not a normal thing. So anything abnormal has to be treated. And hernia is such a problem that although we find that it's a small bulge or a small hernia, not causing any symptoms, not bothering the individual's life so much, but eventually all of these hernias do develop complications, and they grow in size, and they definitely have some consequences, health related hazards. So all the hernias will require treatment, and currently the best treatment for hernia is surgical correction of them. So we do not have any medical form of managing these hernias, because all these hernias have a structural defect, and a structural defect has to be repaired by a surgical process. And nowadays, with the advancement in the type of surgeries, the treatment of hernias has become very simple. But the bottom line is all the hernias need to be treated, and the most effective treatment currently is surgical correction.
So doctor, what are the latest surgical advancements or techniques for hernia?
So traditionally, the hernias have been treated in the conventional way of doing a very open surgery. We used to open the whole abdomen, correct the defect, and place a mesh. That is the ideal treatment which was there. That's a conventional treatment. But of late, we have developed the treatment of hernias in a large scale way. We have moved from the open surgery to minimal access surgery, from minimal access. In minimal access, we have laparoscopy to robotic surgeries, and there have been a lot of advancements in the type of the meshes we are using, meshes which do not disturb the internal architecture of the body, they do not cause any adverse effects on the body. So open surgery is a little lesser commonly done nowadays. The current advancement in the surgery is the robotic hernia surgery, or any minimal access surgery. Laparoscopic hernia surgery is the gold standard currently. The advancement over a laparoscopic hernia surgery would be a robotic hernia surgery, but all the hernia surgeries should involve repairing the defect of the hernia and placing an appropriate mesh.
So how is the post-operative period and how is the recovery time? And does hernia reoccur for the second time in these patients who get operated?
Yeah, that's very important, because obviously once we know that surgery is the treatment for these hernias, most of them get worried that surgery could be very huge and the recovery could be very long, and what are the after effects of this hernia? Is it a permanent cure? So the recovery for a hernia is pretty quick nowadays with the minimal invasive surgery and the advanced meshes that we are using. So the hospital stay is only a one-day hospital stay, and the next day the patient walks back home, and they would take a nominal rest of a couple of days at home, and then they can be back to their work. However, there are few precautions which they would need to take, like avoiding strenuous activities, lifting very heavy weights over a period of 4 to 6 weeks. So the recovery has been sorted out in the treatment of hernias, unlike the olden days where a conventional open surgery would have taken months together of rest, and infection in the wound would have been another big issue. But nowadays we do not have any such issues. And cosmetically, it's very, very good in the sense that you only have 2 or 3 small holes without any big scars. So that is the advancement in the surgery, and the recovery is pretty quick. And they can get back to their previous work. Many of them have this doubt that after hernia surgery, will I be able to do my original work which I was doing, even though it's a strenuous work? Can they hit back their gyms? Can they do the yoga? All those things. So after this hernia surgery, for 4 to 6 weeks period, we will be able to assure that all these patients will be able to do all the normal activities as before. As far as the recurrence is concerned, yes, there is a chance of recurrence of a hernia if it is not done appropriately, if appropriate size mesh is not used. These are the technical factors. And also there are some patient factors, like if the patient's muscle is very weak and there is a lot of laxity in the muscle, and if patient has got some aggravating factors, like he has asthma where his chronic cough, he's been a smoker, and so long-term cough or chronic constipation, these are the factors which can cause recurrence of the hernia. Having said that, in spite of the presence of these factors, we definitely can do some of the technical modifications whereby the recurrence can be brought down to as low as possible. Currently, in a minimal access surgery, the laparoscopic hernia surgery, robotic hernia surgery, the literature recurrence rate is less than 1%, which is pretty good in the current times. So we can safely say that recurrence in a hernia should not be possible.
So doctor, what are the measures that one can take to prevent hernia, and what are the lifestyle modifications that one can follow for this condition?
Yeah, so as I said in the initial part of the discussion, that obesity or overweight or adding weight is an important cause of hernia. So obviously, if we have to prevent a hernia, then we have to make sure that we do not get obese, or if we have already gotten obese, then weight loss is one of the most important factor. Second thing is, we already know some of the aggravating factors for hernia. Say, for example, we discussed about the causes of hernia, like in men who are heavy strenuous workers, or who hit the gym very regularly and do a lot of heavy weightlifting. So they must all use some protective wear which are very much available, which can prevent the groin hernias and the umbilical hernias. And in women, when post-pregnancy, obviously the muscle weakness is going to be a little high. So after the delivery, they have to take adequate measures to strengthen their muscle tone of the abdomen, wear some abdominal corsets which can prevent the bulging of the muscles and thereby causing hernia. So the lifestyle modifications definitely include to not gain excess weight, and also to prevent side effects of doing excessive workouts and yoga. So we have to take certain preventive measures at the potential sites of hernias to prevent them, and they are very much possible.
So before ending this episode, doctor, is there any message that you would like to give to our audience out there as far as hernia is concerned?
So I would like to say that hernia is one of the most under-identified cause. It's one of the condition which is overlooked by many people because it doesn't cause symptoms at some times. So one should be very much aware of what a hernia is and what are the potential sites a hernia can occur in an individual. And also, once there is a hernia, never neglect it. You should approach a doctor and look at if your hernia is of what size, what is the size of the hernia, what is the type of the hernia, and how potential that hernia is in causing some of the complications in you. As I have already alluded, that hernia needs treatment, and currently surgery is the best treatment available. So watch out for a doctor who can offer you a hernia treatment in a minimal access approach. It could be a laparoscopy or a robotic. Make sure that a mesh is incorporated while a hernia is treated. So awareness about having a hernia and getting treated is most important thing.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you. Pleasure always.
So this brings us to the end of this episode. Hope this episode was informative on the topic hernia, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.